I've been a nurse now for 32 years, and I've worked here in the Asthma Center for 18 years, and I love nursing, and I really believe in education. So here in the Asthma Center, we educate children, we educate adults with asthma, and we educate the families too. And they learn about their medications, they learn about what triggers their asthma, and then we work with them to develop an action plan so that when they're home, they have a flare-up or asthma exacerbation, they know what to do. I always wanted to be a nurse, and asthma, I had a particular interest in it. My grandmother had asthma, she lived with us, and back then we didn't have puffers. And so she had really severe asthma, had multiple hospitalizations. So I always had an interest in this. And when I worked in pediatrics, we'd see so many children that would be admitted for asthma, and I thought there must be a better way. And so empowering parents and teaching them more about their child's asthma makes a difference. I would tell them that I educate families who have asthma, that I empower people to take a more active role in their treatment, because we know that an empowered person makes informed decisions if really good information leads to good health. Well, I think our training as a nurse has provided me with a good base and the proper knowledge that you treat the person as a whole, that you don't just look at the person standing in front of you, you look at they have a family, there's a community, there's extrinsic influences that affect them. And you know, you can teach someone how to take their puffer and all about their medications, but if they really can't afford the medication, they're not going to get better. So I think as nurses we have those interpersonal skills that we can break down those barriers, and we act as a resource. We're a liaison between the patient and the physician, and we encourage collaboration. I'm currently employed in the Asthma Center, and I love working here. I can work independently, and I think maybe every nurse that's moved from acute care has more autonomy, but I'm really fortunate that I have a nurse manager that believes in preventative health, and that's what we do here is prevention. It's a lot easier, cheaper, healthier to help prevent someone from starting smoking, overeating, having asthma attacks than it is to treat the disease after the fact. So it can be really difficult though to get funding for preventative medicine, and we decided here that we would keep data, and we collected information on how often someone went to the emergency department, went to the admitted to hospital 6 months before they came in, 6 months afterwards, and we found that there was a huge drop in healthcare utilizations. So that's a savings to the healthcare system, but not only that, to the person, because they're not missing time from work, so therefore their employer's happier. He's not missing an employee that's not going to work. Or if you have a child that's not missing as much time from school, and therefore the parent's not missing time staying home with the child. Those are all really gratifying. I think nurses are very good critical thinkers, but I also think that we do evidence-based nursing, so that we have guidelines that we follow. We don't just pull information out of the air. When we're talking to someone, it's based on evidence and guidelines for asthma management. I have certification in asthma education. I'm continually updating my skills, and I think that's really important. And I also think that we practice ethical thinking, and on a day-to-day basis when we're interacting with the patient, we're always making ethical decisions, and I think that's crucial. I've been a nurse for 32 years, so I have a lot of experience, and I'll tell you, experience, no matter how vast, is useless if you don't share it, right? So the thing is that it's important to network with other nurses, and it's important to share your information, share your successes, but also your pitfalls, so you can learn from that. You know, I think, Audrey, we're seen by the public nurses as having integrity, and that's very important. And also, it's important to be judicious with how healthcare monies are spent, and having a lot of hospitalizations and emergency room visits. So that's an expensive way to do business. So if you can prevent a hospitalization, but not only are you saving money, but you're also decreasing the wait list, so someone else can see a respirologist that may be waiting. You're also freeing up a bed for maybe someone who had surgery. And those things are all really important. And those are sort of the big things. But some of the simple things would be a child that, when he comes back for his second visit, he says, you know, I'm playing tag in the school ground now. Whereas before he never played tag, and his parents didn't even realize he didn't. Or you might get the child that has severe asthma, that has had multiple hospitalizations over the winter, and after teaching them about her medications and what to do for her triggers, and helping the parents work out an action plan, she's gone through the whole winter without a major flare and without a hospitalization. It's also the coach that says to the parents, what did you do with this kid? He has so much more endurance, and in hockey he's not short shifting anymore. Those are really gratifying to me, and that's what keeps me coming to work every day. So, you know, everyone likes to work in an environment where they feel they can make a difference, and I feel inspired when I come to work. I really enjoy the people I work with. I work with people that have high standards and believe in continuing your education so you don't get stagnant. And that's really important to me. And asthma is just, there's so much new research coming out about it every day. And we're seeing now that if we can prevent these, especially women smokers that we're seeing an increase in, if we can prevent them from smoking. So if you get these, I love working with the teenagers, if you can get them not to smoke, and if you talk to people about their home environment and their triggers. We're now doing allergy testing, and so that makes a huge difference for people with allergies, and that just keeps me coming back every day. I love my job.